This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right, so today I'm going to talk about a hot topic in medicine / psychiatry right now, which is psychedelics. Everybody knows that's like the big deal right now in psych. They're being studied for a lot of mental illness, and they're overall looking pretty promising for treating a lot of mental illnesses like depression, PTSD, and anxiety. Just as a quick overview, some of the classic psychedelics are psilocybin, LSD, ayahuasca, stuff like that. MDMA and ketamine get lumped in there as well, even though they're not classically psychedelics. They're not 5-HT2A agonists, but they do kind of induce neuroplasticity in a similar way. The thing that I want to talk about today, though, is from like an emergency perspective, is what are some of the risks that we see from psychedelics? And one of the big things to keep in mind is the risk of psychosis or severe hallucinations. There was a study in November. It was a retrospective cohort study that looked at incident ED visits for people on hallucinogens and subsequent risk of being diagnosed with a schizophrenic spectrum disorder in the 5 years after that. They actually found a hazard ratio of up to 23, which means like they had a 23 times elevated risk of being diagnosed with a schizophrenic spectrum disorder. Now, this is, of course, people on hallucinogens that are presenting to the ED. So there's a lot of compounds there. They did control for comorbid substance use and pre-existing mental health conditions and still found a 3 times elevated risk of being diagnosed with a schizophrenic spectrum disorder after that. So they did not say whether the patients received antipsychotics in the ED, so that could be a potential way to mitigate subsequent schizophrenic risk. And then the other thing too is, could there be other compounds? Like, we know that the ED is like not the best place for someone on a substance like that, right? It's a very chaotic environment, so they may just be getting worse in general, and that could also be contributing to later psychosis. But it was an interesting study nonetheless, something to look at for sure. Thanks.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.